That patient was so irritating. He was demanding and kept interrupting me. I hope I don't see him again.
Oh, she spent some time on the inpatient unit. Don't give her the benefit of the doubt. She's just looking for attention.
If you've ever worked with her, you know she's trying to put one over on you. She's been gaming the system for years. I think we should cut her off.
I'm so sick of these people coming in with opioid overdose. They bring it on themselves. Why should we spend the money and time and a full staff for that emergency? All they had to do was stop using.
These are examples of how stigma surrounding mental health and substance use problems can affect people who are seeking care. In medical settings like doctors' offices, urgent care clinics, or hospitals, medical staff can, consciously or unconsciously, allow that stigma to cause discrimination against someone based on symptoms or history. The way medical staff members talk about mental health problems can determine the type of interaction and services offered to a person. To increase your own awareness and prevent this from happening, keep a few ideas in mind. Patients aren't perfect. Mental health problems are not a sign of weakness and can be just as distressing as physical problems. They can also cause as much or more impairment in daily functioning. If patients are irritable, sad, confused, or need extra help, the source of their suffering should not matter as much as how their needs will be met. Avoid common stereotypes. When you hear words like crazy, psycho, lazy, or addict being used about patients, step back and consider the impact these labels have on the person. That person is there for help, and stereotypes only increase the distance between caregivers and patients. Don't be afraid. A common misunderstanding about people who experience mental health problems is that they may be dangerous. In fact, people with mental health problems are far more likely to be victims of crime than to commit them. Even if someone is irritable, that's very often a symptom of something else rather than a threat of danger. Close the gap. Simple questions like, "How can I help you?" or "I'm concerned about you and I want to help," can go a long way towards inviting a conversation rather than a conflict, especially if a person is in distress. Use person-first language. Mental health problems should not be used as labels for people. For example, it can be tempting to use shortcuts to talk about someone as bipolar or an alcoholic. Using language this way reduces people to the names of their disorders and makes it easy to disregard the rest of their lives. Using language such as the patient experiences symptoms of bipolar disorder or has a diagnosis of a substance use disorder makes it more likely that the patient will be treated with dignity and respect, with an identified condition and a promise of recovery. This language might be the difference between a person giving up on treatment and having hope for a healthy future. Stigma and discrimination are as evident in medical settings as anywhere else, but it can be difficult to spot them. After all, just about everybody working in a medical setting is there with a true desire to help people. The language we use can be meant as casual, quick, or even humorous, but it can unintentionally affect patients in harmful ways. Being intentional about language and attitudes can help ensure that people experiencing mental health problems are treated with the respect and dignity that they're entitled to. Your patients deserve nothing less.